Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
Well, our opinion, of course, Bob.
That's our opinion. Brad, today we're going to talk about vertigo and which treatment should you do. There's a lot of videos on vertigo, and I think there's got to be confusion out there about which treatment you should do because there's a lot of different treatments.
And people may be getting dizzy over it.
Right.
No pun intended.
Right. And it is dizzying. The whole the dizzying. Let's start off with. Basically, I want to know that you went to the doctor, and what this video is mainly about is Bppv.
That's the most.
You want to say it, Brad?
Benign prime proximal positional vertigo, and
right.
It's in Bppv, which is also kind of hard for me to pronounce.
Now, this by far is the most common vertigo. And vertigo, by the way, is just spinning. It's that sense of spinning that you're going to feel. And if you have vertigo that's lasting, it gets turned on and it lasts for 15 minutes or 30 minutes, this video is not for you. You need to go to the doctor. That's going to be maybe a migraine or Meniere's disease or something like that. This is not treatable by what Bppv is. We want to know that your sense of spinning is going away after a minute or two, or maybe less than a minute.
Right.
Then this video is for you. So let's start off with, let's say you're, oh, by the way, these are the 3 different treatments. So this just shows you how confusing it is. Really, almost you can even say 4. The Bbq is the most common treatment, and that's the one you're going to do the most commonly. It's also called the CRT, the Canalith Repositioning Treatment. So after if we make a recommendation and you want to do this one, you want to look up our video on the Bbq. There's the liberatory method, or maneuver, I think they call it. And then there's the Bbq Roll, which is, I'm sure, your favorite, Brad.
You bet.
All right, so let's say you got symptoms. And your symptoms, we're going to start off with when you turn to the right or roll to the right, or it seems to be when you go to that right direction, you start getting symptoms.
Sure.
You get the spinning sensation. If those symptoms last less than 60 seconds, you're going to want to do the Bbq. And maybe, and we're saying to the right, so you want to do the Bbq to the right. So, Nancy, if you want to put a link down below, we have a video on how to do the Bbq to the right. Bbq or CRT to the right. All right, let's say you go to the right and it lasts more than 60 seconds.
Sure.
Not a real long time, but maybe a couple minutes. Then you're going to want to do the liberatory to the right. Are you still following me, Brad?
So less than 60 seconds, you're going to use the Bbq. More than 60.
The liberatory.
Okay.
Okay?
This has got nothing to do with politics.
No, not conservative or liberatory or... All right, now we're going to go to the left. Now you have symptoms going to the left.
Sure.
And it's going to be the same thing. If it's less than 60 seconds when you turn to the left to get your symptoms, it's going to be the Bbq or the CRT.
And it's designated to the left.
Yep.
And we have a video on it.
We have a video of it. Linked right below. All right, if it's more than 60 seconds, you're going to do the liberatory maneuver. I mean, I said more, that's more. More than 60 seconds. To the left, liberatory left.
And we'll have a
link for that. Okay? Now, finally, let's say you're getting symptoms to both directions, especially, maybe not even dizziness, but maybe what we call nystagmus, where your eyes are going back and forth. And this one's a little more complicated on which one you would do. This one you probably almost need a physical therapist.
Right.
But if you are getting symptoms in both directions, if you want to try something, you might try the Bbq Roll. The problem is I won't know which direction you should do it because it needs an expert to tell you.
Sure.
You actually have to look at their eyes and see which way they're moving.
Sure.
And that would tell you if you should do it to the right or to the left. And so I would probably try it to the right and the left, and if it takes away your symptoms, if one of them takes away your symptoms, that's the one I would go with.
Right.
If it's not, then it's probably not even Bppv. It's probably something else, and you need to get it, again, further diagnosed by your doctor. So that's it, Brad. That's the 3 treatments, or really almost 4 if you want to include that as another possibility. And link to our other videos and give this a try. Very highly treatable.
Right.
And very good results with this. And I hope you have some good luck with it. Because we can fix just about anything, Brad, right?
We are working on it. The only thing we're having a problem with is that broken heart. But, I think we can still work on it. I think we got a nice book. This is a good start.
Yeah.
So, anyways, take care and have a good day.
We forgot to mention where our source for most of this information, Brian,
Right.
which is Vestibular Rehabilitation. It's the 3rd edition. It's by Susan Herdman, and I believe she's a physical therapist, Brad.
Sure.
And, very, very informative, very in-depth, comprehensive textbook. I would recommend it to any physical therapist or anybody who's interested in this field.
Sure.
Thank you.